Hi everyone, welcome back to Game Pharmacology. In this session, let us learn about what are all the drugs which can be used to prevent the anti-cancer drug-induced toxicities. So, let us learn about the drugs used for preventing anti-cancer toxicity. Anti-cancer toxicity. First, we have a allopurinol. Where do you use allopurinol? Allopurinol is a xanthine oxidase inhibitor. It is a xanthine oxidase inhibitor. It is a xanthine oxidase inhibitor. Thereby, it prevents the hyperuricemia. It prevents the hyperuricemia which is caused by the tumor lysis syndrome. Tumor lysis syndrome. So, in case of tumor lysis syndrome, you can use the allopurinol, which inhibits the xanthine oxidase. Thereby, it prevents the increase in the uric acid levels. Similarly, there is one more drug, that is the rasburicase, which is the uricase, recombinant uricase, which are, this is the recombinant urate oxidase. They are also used in the treatment of the tumor lysis syndrome induced hyperuricemia. Which is the fastest among this, allopurinol or rasburicase? Please remember, rasburicase is the fastest acting agent which can reduce the uric acid levels. How? This being a urate oxidase, this will be converting into uric acid. Uric acid will be converted into allantoin, which will be easily excreted out because of their increased water solubility. So rasburicase is the fastest agent which can decrease the uric acid in the tumor lysis syndrome. Next, you have a mesna. Where do we use mesna? Mesna, the drug of choice, you can say. It is used as a neutralizing agent in the treatment of where you will use in the treatment of hemorrhagic cystitis. They are used in the treatment of hemorrhagic cystitis. Which are the cystitis? Which are the drugs which are causing hemorrhagic cystitis? Those are the cyclophosphamide and the ephosphomide. So these are the two drugs which will going to cause the hemorrhagic cystitis. So adding up of mesna will neutralize the formation of the hemorrhagic cystitis. Here the culprit will be the acrolein. So this mesna will neutralize the acrolein and it will be easily excreted through the urine. Next, we have a leucovorin, where it helps in replenishing the tetrahydrofolic acid. Where you want to use leucovorin? In case of any of the usage of anti-folate drugs, especially the methotrexate, methotrexate. So this is called as leucovorin rescue. So this can be called as leucovorin rescue, or it is also called as citroforum factor, or it is called as folinic acid supplementation. So it is given in the to treat the folic acid deficiency in case of methotrexate. Next we have a amifostin. So where do we use amifostin? In case of the cisplatin induced nephrotoxicity. As you can see, it looks like a C here. So kidney here look like a C. So cisplatin will going to cause nephrotoxicity. So this can be controlled by giving the amphotericin B. So it will sit in top of the kidney and it prevent the hepatotoxicity induced by the cisplatin. Cisplatin will induce the nephrotoxicity. So thereby amifostin will sit here and it will inhibit the nephrotoxicity induced by the cisplatin. So this is one use. Apart from this, they are also used for preventing the radiation induced xerostomia. Please remember, radiation induced xerostomia. radiation-induced xerostomia, and the cisplatin-induced nephrotoxicity. The next coming to the, so very, very important, this has been asked many times in your exam, amifostine for xerostomia as well as the cisplatin-induced nephrotoxicity. Then we have a dexarazoxane, dexarazoxane, which is a iron chelator. Please remember, it is a iron chelator, where we want to use this to prevent the cardiotoxicity due to anthracyclines. As you know that anthracyclines are the most cardiotoxic anticancerous drugs. So here you need to use the dexarazoxane. So you can draw a diagram. So this is the cardiac. So on the top of the cardiac, the D are located, 2D. One is the doxorubicin is causing, and the same D is the doxaroxazone, which is the rescue drug which prevents the cardiotoxicity. So doxorubicin is a anthracycline. So doxaroxazone is the one which will going to prevents the cardiotoxicity of the anthracycline because of their iron chelating property. Next we have a palifermin. So palifermin is nothing but it is a keratinocyte growth factor. It is a keratinocyte growth factor where it is used to prevent the myositis. It is used to prevent the mucositis. So remember, palifermin is the keratinocyte growth factor. They are used to prevent the mucositis. So then next we have a pilocarpine. Where do you use pilocarpine? Pilocarpine is a cholinergic agonist. It can be used in the treatment of the radiation-induced xerostomia. One more drug is the cevamelone. Cevamelone is again the cholinergic agonist which can be used similar to that of the pilocarpine. That is the cevamelone. Next is the very important again these drugs, and next is the pomedronate and zolendronate. Pomedronate and zolendronate are the bisphosphonates group of drugs mainly used in the treatment of hypercalcemia of malignancy. So it is also very important. So in case of hypercalcemia of malignancy, which will be the rescue drug? That will be the bisphosphonates. So bisphosphonates are the rescue drug in case of the hypercalcemia of malignancies. Then next you have a very important group of drugs, that is the epoetin alpha and the darbepoetin alpha. Where you want to use this epoetin or darbepoetin? The name itself suggests that poetin. They need to increase the blood production. Where you need to increase the blood production in case of the conditions like anemia. In conditions like anemia, you need to increase the blood production. Please do remember this. Very, very important. Darbepoetin alpha and epoetin alpha, they are used for, they are the erythropoietins. They are used in the treatment of anemia. The next group is also very, very important, filgrastim and pegfilgrastim. This has been asked many times. Again, filgrastim and pegfilgrastim, they are the growth colony stimulating factor, granulocyte colony stimulating factor. This has been used in the treatment of febrile neutropenia. There is one more group of drugs, very, very important, sargramastim. The difference between the filgrastim and sargramastim is filgrastim is a granulocyte colony stimulating factor, whereas the sargramastim is the granulocyte monocyte colony stimulating factor. Again, you should remember this. This is the GM colony stimulating factor. This is the G colony stimulating factor. Both are utilized in the treatment of febrile neutropenia. Then we have a oprilivikin. Again, this is very important. Oprilivikin is a interleukin 11. They are used in the treatment of thrombocytopenia. To increase the platelet count, we will use the oprilivikin, which is a interleukin 11. Please remember, it is a interleukin 11 used in the treatment of thrombocytopenia. Next we have a trilacicib, which is a CDK4 and 6 inhibitor. Please remember, again it is very important, trilacicib is a CDK4 and 6 inhibitor used to prevent the bone marrow suppression. suppression, used to prevent the bone marrow suppression. Next we have a ondansetron. Please remember, next we have ondansetron, granisetron and the palinosetron. These are nothing but the 5-HT3 antagonist, 5-HT3 antagonist. Where we want to use 5-HT3 antagonists, they are basically used in the treatment of post-operative cases. Post-operative nausea and vomiting, chemotherapy induced nausea and vomiting, that is chemotherapy induced nausea and vomiting, radiotherapy induced nausea and vomiting. In all the cases, the drug of choice will be your ondansetron, that is the 5-HT3 antagonist. 5-HT3 antagonist, very very important again. Then next comes the aprepitant. Aprepitant is also very very important. Aprepitant is the NK1 antagonist. NK1 antagonist, where you want to use aprepitant in case of cisplatin induced delayed vomiting. Cisplatin induced delayed vomiting. Please remember, aprepitant are used in the delayed cisplatin induced vomiting. It is a NK1 antagonist. NK1 antagonist. So these are some of the very very important drugs that can be used to reduce the toxicity produced by anti-cancerous drugs. Thank you.